Good morning, Dr. Mix here in Bastrop, Texas with Adjust, and I'd like to talk to you today about why we make the recommendations we do at Adjust. My recommendations come after, we have a consult, after we perform some type of exam, measuring the nervous system, measuring your spine to see what the alignment looks like. Does it have the curves like this one does here behind me? Or is it lost its natural normal position to allow the brain to function with the rest of the body properly? So after we've evaluated on the follow-up visit, we show it all to you, and assuming we can help, apply the first adjustment and in the manner of that is best for you, meaning we want to make sure that we give the best possible adjustment that's the most precise, that's able to release that impingement on the nervous system so that you may be as healthy as possible. And so when we do that, people respond differently. Some people hold their adjustment, meaning we get the alignment in the best possible fashion. The nervous system is able to work really well, and the spine, for the most part, stays in that position for 24, 48, 72 hours, maybe longer. Some, it wants to revert back to its former subluxated pattern, meaning affecting the nervous system negatively. How fast that happens is what I'm trying to determine by the visit after that. And that's where we go over recommendations, meaning what's the repetition need to look like? Are you holding the adjustment that we performed, or is it trying to come back out of alignment again because of years and years of being subluxated, being out of alignment? So it's the difference between what this spine looks like compared to what this spine looks like. Healthy disc spaces, healthy cushioning in between the vertebra versus decreased disc spaces and bone changes as well. That will cause the body to not want to hold the adjustment as well, obviously. That's called degeneration. It's from a period of time where the spine was not in the best position, the spine wears funny, the discs decrease in height, but the most important thing is the nervous system has not been allowed to work as well as it should during that time period. When the nervous system is depleted over a long period of time, it takes some time to restore balance to that. So when we give our recommendations, it's based on that, but more importantly, it's based on your goals. Are you as a patient just want to get out of pain and discomfort, or do you want your nervous system to work at a higher level of health so that you can reach whatever potential we have left? Look, let's be honest. The potential of this person is diminished. There is a loss of control now between the brain and body. The nervous system is impacted from multiple angles because of the changes that are seen. This person has much more room for the nervous system to work. So some people have a better potential for health than others. So how do you maximize your potential? You follow the chiropractor's recommendations. It's that simple. So many people want the results but don't want to put in the time. And you could say that with any profession. My financial advisor would tell you, people tell him that all the time. They want to be able to retire now, but they don't want to save up yesterday. So it's unfortunate, but healing does take time. And but aren't we worth it? Aren't we worth it? Aren't the things that we want to do in our life worth it to give it the time? Listen, we keep the adjustments quick and simple. All the work is done behind the scenes. Me and other chiropractors that perform similar work that I do are here on their days off, not seeing patients, working on x-rays, working on exam findings behind the scene so that we can prepare to give you the best care possible. That's what a chiropractic should be doing for you, that's what a chiropractic office should be able to perform for you. So thank you very much for listening. If you have any questions, please ask. And our goals, in summary, are wrapped around really what you want to achieve in your life. Have a wonderful day. Stay warm. See you next time.